Have you ever experienced a burning pain in your upper stomach, felt unusually bloated after eating, or suffered from persistent nausea without knowing why? Sometimes these symptoms are caused by a condition called gastritis, where the lining of the stomach becomes irritated and inflamed. While it may seem like a minor digestive issue at first, untreated gastritis can lead to more serious complications over time. So, what exactly is gastritis? Gastritis is a condition in which the lining of the stomach becomes inflamed. The stomach normally produces powerful acids and digestive enzymes to break down food. To protect itself from these substances, it has a special mucus layer that acts as a protective barrier. When this protective barrier becomes weakened or damaged, stomach acid can begin irritating the stomach lining itself. This irritation triggers inflammation, resulting in gastritis. Gastritis can develop suddenly. This is known as acute gastritis. It can also develop slowly over many years. This is known as chronic gastritis. Both forms affect the stomach lining, but chronic gastritis may cause long-term damage if left untreated. One of the most common causes of gastritis is an infection caused by a bacterium called Helicobacter pylori, often shortened to H. pylori. This bacterium can weaken the stomach's protective lining and increase inflammation. Other causes include the long-term use of pain-relieving medications, such as anti-inflammatory drugs. Excessive alcohol consumption, smoking, severe stress, and certain autoimmune conditions can also cause gastritis. The symptoms of gastritis can vary. Common symptoms include burning stomach pain, nausea, vomiting, bloating, indigestion, loss of appetite, and feeling full after eating only a small amount of food. Some people may have gastritis without experiencing noticeable symptoms. If gastritis continues for a long time, it can damage the stomach lining and increase the risk of complications. These may include stomach ulcers, bleeding, and in some cases, stomach cancer. The understanding of gastritis improved significantly after scientists discovered the role of H. pylori in causing stomach inflammation. This discovery changed how many digestive conditions are diagnosed and treated. Treatment depends on the underlying cause. If an H. pylori infection is present, doctors may prescribe antibiotics to eliminate the bacteria. Other treatments may include medications that reduce stomach acid, protect the stomach lining, and allow the tissue to heal. Lifestyle changes can also help. These include avoiding alcohol, smoking, and foods that irritate the stomach. Today, artificial intelligence is helping doctors diagnose gastritis and related digestive disorders more accurately. Artificial intelligence systems can analyze endoscopy images, biopsy samples, and patient records to identify signs of inflammation, ulcers, and H. pylori infection. Some artificial intelligence-assisted endoscopy tools can detect subtle changes in the stomach lining that may be difficult to recognize during routine examinations. This can help doctors diagnose problems earlier. Gastritis is a common condition that occurs when the stomach's protective lining becomes inflamed. Understanding how it develops highlights the importance of protecting stomach health, treating underlying causes, and seeking medical care when symptoms persist. But inflammation is not the only problem that can affect the stomach. In our next video, we will explore stomach ulcers explained and discover what happens when acid creates open sores in the stomach lining.